Welcome, everybody. This is Coin 6 News at 5 o'clock. I'm Jennifer Hoff.
And I'm Jeff Gianola. Health officials in California now confirm they have 2 more new coronavirus cases in the Silicon Valley. And one of the patients is the second in California this week to be infected without traveling internationally or be in close contact with someone who had it. Oregon Representative Kurt Schrader says we don't need to panic, just listen to the experts.
When you're trying to figure out, what's going on, don't listen to the social media. Let's just listen to the experts. Let's get some coordination with the communicable disease folks, HHS and USDA. Let's have a thoughtful approach.
Well, Congress is now working on a spending bill for antivirus efforts to be unveiled next week.
And as concerns about the coronavirus grow, the Oregon Health Authority wants everybody to know that they are prepared if the virus comes to the state. And they briefed the House Healthcare Committee today on how they are monitoring the virus.
Our Belina Jones was at that meeting and joins us live from the Human Services Building in Salem. Belina?
Well, Jeff and Jennifer, the Oregon Health Authority tells me that they have been preparing for weeks and will only continue to ramp up their plans, adding that working with state, local, and federal partners will be key.
The risk to Oregonians is low. Certainly that could change very quickly.
In that event, the Oregon Health Authority told the House Health Committee today they are not only prepared, but say their response is similar to when they responded to H1N1 and Ebola concerns.
Our systems are really ready to be able to respond to this, and we want people to be prepared and to be concerned, but to not panic, because we have experience managing these kinds of issues.
Those preparations, according to OHA Director Patrick Allen, include scaling up hospital and health systems, preparedness, along with EMS.
Part of the 911 dialogue, while it doesn't delay an EMT unit or something like that going out, includes questions about travel history and symptoms so that the first responders can be properly protected when they arrive at a site.
In the event of an outbreak, lawmakers want to know if the state is also financially prepared. OHA received a crisis grant, adding it's too early to tell just how far the funds will go.
What will be the responsibility of states to take this on kind of ourselves if a worst case scenario were to happen?
Or it would come from CDC to the states, and then we would we would send that out to our local partners and our tribal partners the way we normally do public health emergency preparedness funds.
Challenges like the current global shortage of supplies and protective gear, no vaccine, and testing solely handled by the CDC brought more concerns.
What is the surge capacity for the state? How many people actually would be putting us at the part where we're actually needing to get help?
We have emergency responders that we can pull in within OHA and within our local public health authorities to expand the workforce on a temporary basis.
Now, the Oregon Health Authority is also partnering with Governor Brown and her coronavirus response team. Along with other partners, they will be meeting regularly to continue to update their plans. Reporting live in Salem, Belina Jones, Coin 6 News.